Good afternoon, everybody. I'm Dr. Prashant Pawar. I'm a head and neck cancer surgeon, and my topic of today's presentation is care of a voice prosthesis. Care of the voice prosthesis is a very important topic. As we all are aware, whenever we deal with stage 4 laryngeal cancers, patients who have to undergo a laryngectomy, uh, voice box is one of the most important organs that we have because it's an organ of communication. And after whenever we counsel the patient about laryngectomy, the first thing that they will always be worried about is that am I going to lose my voice? So this is where the voice processes comes into picture. This is just a small slide showing the change in anatomy. Once you remove the voice box, as you can see, the trachea is diverted onto the stoma, which is an opening made into the neck. And this is where the voice process comes into picture. What a voice process basically does is acts as a one-way valve. So we make a puncture in the posterior wall of the trachea and open it into the esophagus. What this voice processes does is basically when the patient occludes the stoma with the thumb, it shunts the air from the trachea into the esophagus, goes into the upper airway, and that is how the patient is able to phonate. So the most important function that this processes does is actually not just shunting the air from the trachea into the esophagus, but at the same time it prevents any leakage from the esophagus like food particles or fluid or saliva from entering into the trachea. That probably is the more important the function of the processes. So how do we take care of the processes? As we all know, the voice processes at present, the ones that are available are very expensive, almost to the tune of 20 to 30 lakhs, 20 to 30,000 every device, that is the cost. And many times what happens is that the patients may have to undergo a change of voice processes for whatever reasons. If they get damaged, it's not able to speak. So many times they have to change, and every change then again it means a cost of around 20 to 35,000. That is the reason why we also should always take good care of the processes so that we can prevent whatever problems we are that are associated with the processes. So what are the problems associated? Most commonly we come across infections, leakage from the processes. Again, leakage, there are two types: central leak and peri-TEP leak. The valve can get blocked because of debris, mucus secretions, and also change in voice because of wear and tear. If the valve gets damaged, then there can be poor quality of voice, or sometimes the patient can be aphonic. So we are basically trying to improve the life of the processes and to maintain a particular quality of the speech that the patient has. So what is the armamentarium for taking care of the processes? The first and foremost thing is a good light source. Now this is something that is going to be like a self-care by the patient is also done in the similar manner, and we as medical professionals can also help the patient. So if the patient is using it, doing it by himself, we advise to have a good mirror, a good light source, and two important parts which are provided with the processes are the brush and the flush. Apart from that, just warm water, gauze pieces. Always ensure that your hands are clean before and after cleaning the processes. Now, how to use the brush? I'll just quickly go through and then I'll show you a video as well. So first and foremost we have to use a clean brush. After cleaning the brush with water, ensure that there's no excess water in the brush. Gently insert the brush into the processes from the tracheal flange and ensure that it goes behind, but do not push too far. It can actually cause physical damage to the fourth wall. And the method of insertion is actually continuous turning motion. And whenever you are bringing it out as well, it has to be the same way, because you can actually push the entire processes anteriorly and posteriorly, causing extrusion of the processes either into the trachea or into the esophagus as well. Clean the brush when you are removing it out and repeat it as many times as is necessary. Usually we prescribe the patient to at least clean with the brush twice daily, once in the morning and in the night as well. And always we tell the patient the same thing, that do not use too much of excessive pressure. Then how to use the flush? Flush is used, after you're doing the brushing, sometimes you can see that there are some particles remaining there. So you can use a flush which is filled with water, and it's used to actually flush whatever small particulate matter is there within the processes through the valve into the esophagus. So It's a very nice design that they have, so which prevents any leakage of water back into the trachea. So once it's snugly fit, it just tip opens up the valve and you're able to flush. So this is a patient video. This is showing how to use the brush. See how she's using a circular motion while she's inserting into the prosthesis. A good wide stoma or flat stoma is always very essential to have adequate illumination there. Okay, and see how gently she is using the brush. You should not use excessive force while cleaning the prosthesis.
One more time.
Then this is the flush. Okay, and see how the design actually snugly fits against the tracheal flange, so that there is no reflux of water into the trachea.
And remember to release it before you pull
So that's
it
the
out.
flush.
You'll pull it.
So this is about cleaning of the processes. And how do you take care of the brush? We have to wash it with soap and water before and after use, every use. Disinfection can be done with the help of either a Savlon solution or any antiseptic solution for that matter. Just keep it there for 10-15 minutes. And you have to clean it every time, that's more important. And you have to keep it in a clean and dry place. Make sure that the brush should be changed whenever you have the bristles fraying, and do not keep on using it, because if you have fray bristles, then you can actually cause physical damage to the valve. So some more tips to actually prolong the life of the processes. Maintain oral hygiene, which also can cause the contamination of the processes. We ask the patients to brush teeth twice daily, drink lots of water, especially after having meals. We encourage the patients to have a lot of water so that it rinses the processes very well. And if the patient has underlying medical conditions which actually cause compromise in the immunity, then we should treat those as well, like diabetes. I'll show you a small video on assessment of voice processes. I'll play it from the folder. So that's the way a stoma looks, and you can see it's a nice wide stoma, and this is the process which just been inserted, and this is how it should look. And there's a strap, you can see the elongated strap. We do not cut the strap until we are very sure that it's not leaking and it's very well placed. Usually we ask the patient to come back again the next day, ensure that there's no leak, and then we cut the strap. And I'm actually asking the patient to drink water and ensure that there's no leak. So this is how we just assess. So stoma first, assess for the stoma. There's no granulation there around the stoma edges. There are no irregular edges. There's no ulcerations there. And then we look at the prosthesis. Now, after insertion, we also rotate the process and see. And if you can see, this is a nice camera. We can actually see when he's swallowing, we can see the bubbles of water going behind the prosthesis. So nowadays, actually, with good high definition cameras, you can actually observe the water going behind the valve. Now, looking at the leak. Now, a leak is a very important aspect to be diagnosed. Most of the patients, first and foremost, he'll complain of coughing at the time of swallowing water. So this is the first and important symptom that the patient may have a leak. We give the patient to drink water and look at the processes. Now, this is a central leak. There is leakage of water through the central part of the processes. And if it's leaking not from the center but from the edge of the processes, then it's called as a peri-TEP leak. Another problem that you can have is the stenosis of the stoma. This is also very important to see how small the stoma has become. It's almost, even the processes inside you can see is almost bent to because the stoma is so small. Again, these are important problems. Whenever we come across either a central leak or a PEP leak, it's important that the patient visits the medical practitioner, because they may either require change of processes or some certain adjustments. I'll just show you a nice video of TP speech. Can you increase the volume, please?
जिसका मैंने ऑपरेशन डॉक्टर साहब से करवाया था, जिसका मैंने ऑपरेशन डॉक्टर साहब से करवाया, मेरे अंदर स्वर यंत्र लगाया, जिससे मैं मेरा उकर का निकाल कर मेरे अंदर स्वर यंत्र लगाया, जिससे मैं आज अच्छी तरह बात करने के काबिल हुआ हूँ. खाना पीना.
So that is the reason why tracheoesophageal speech is supposed to be the best modality of rehabilitation in laryngectomy patients, because they really are able to achieve very good speech. It's almost near normal speech. And so Just the overview about what are the most common problems that are associated. One is leaking processes, like we just we've just seen in the video a central leak. Similarly, we can have a peritp leak. The symptom is coughing while the patient is drinking. Examination with a good source of light and either by the patient himself or a relative can actually help identify a leak. And this is why a similar kind of a thing actually should be shown to every patient, that what is a leak and when should you present to the doctor. And whenever you have a central leak or something, we always encourage the patient to try cleaning the processes. Sometimes some dirt or debris may be stuck at the valve, and that may be the cause of leak. And just flushing and brushing may help solve the problem of a central leak. If the leak continues, then of course we encourage them to see the doctor immediately. And whenever there is a leak, we should not try to avoid the visit to the doctor, because it can actually cause aspiration, which is more important to problem, and we want to avoid it. Other problem that we have is actually problems with the voice, either a poor quality of voice or unable to phonate at all. Again, that could be because of a damaged valve or a blockage of the processes because of secretions, because of debris, many other things. Cleaning, again, we encourage the patient to clean. If that does not solve the problem, then patient must visit a doctor. Patient may require a change of the processes in that situation. So again, finally, a take-home message. It's very important to take good care of not just the processes but also the stoma surrounding it, and a good clean processes will help in prolonging the life of the processes, because it's a very expensive device. We always encourage the patient to do at least twice every day with the help of brush and flush, like we saw in the video. We encourage the patient to drink plenty of water, and after every meal especially at least a glass of water. And the problems that we are associated with the processes, patients and the caregivers should have good knowledge about what are the problems associated and for which they have to reach the doctor. Maintain adequate oral hygiene and treat whatever underlying medical conditions patients may have. Thank you very much.